Broadcasting from the business capital of the world, this is the Podcast Business News Network.
We are so excited to be back with our certified orofacial myofunctional therapist, Barbara Greene, joining us here today. We're talking about adults today. We've done a lot of talks about children and adolescents, but again, the work she does is beneficial for all of us at any age. Welcome back to the show. How are you?
I am good. How
Yeah.
about you?
And tell us a little bit about what you do. And some people out there may not even be familiar with what a myofunctional therapist is.
Well, I am an orofacial myofunctional therapist. Sometimes we're called tongue thrust therapists. Sometimes it's just ORO myofunctional therapist. So a lot of different titles, but basically what we do is retrain the muscles of the mouth and face. And it means that you are possibly a mouth breather and or have sleep apnea or have TMJ issues. And we'll be talking about all those things today. But basically, you end up with problems. So that's what my therapy is all about, is helping people solve those problems. So here's how to reach me. 805-452-4302. I'm in Ventura, California, but I see patients at my home or virtually. And they can go to my website, www.tonguethrust.com, or reach me at barbara@tonguethrust.com. So today we have all sorts of adult issues that we work with in myofunctional therapy. Pain, which can be headaches, neck pain, tension in the neck or shoulders, TMJ, TMD problems of the jaw joint.
Okay.
Shoulder pain and tension. There's periodontal issues and gum disease or abfractions that people get, tooth loss, snoring and sleep apnea, allergies and congestion, GERD, gas, burping, hiccups, stomach aches, and speech issues, just to name a few of the things that adults can end up having. Orthodontics as children, they had braces. Their parents tried to do the best for them.
Yeah.
But in many cases that I see, the very unfortunate thing is that the orthodontist told them their mouth was too small for all of their teeth. That is never the case. I'm sorry, folks. Don't believe it, and don't have your children have extractions unless it's baby teeth to allow teeth to come in. But adult teeth should not be extracted. So this is a patient that had what they call 4 bicuspid extraction. They take out 4 teeth. There should be 8 bicuspids in your mouth. But when they take out 4 teeth, it only makes their job easier. It doesn't really help you at all, because then, like this woman, her mouth is too small and her tongue is too big for her mouth as she becomes an adult. And so if you look in this person's mouth, look at her cheek tissue over here and over here. She has bitten it to death. And so now she has excess tissue, and sometimes you have to have surgery to have that tissue removed because you keep biting it and it could actually become cancerous.
Yeah.
Then she has all sorts of things on her called scalloping. Some people have ridges on their tongue, and look at the indentations all the way up to the center of her tongue. And then on top of that, she has a tongue sucking habit. So look at the center of her tongue, how irritated, and the tissue is actually breaking down. And so this is a problem. And this is a patient I saw last week. So it is a definite issue. Here's her teeth. She had braces, and she has 4 teeth missing. So 1 tooth here, 1 tooth here, 1 tooth here, and 1 tooth here. And so now her orthodontics has failed. None of her teeth are meeting properly. So she's having trouble chewing up her food. And the pressure on her teeth from her tongue and the pressure of swallowing, the pressure of the habits of sucking, and that she's getting a lot of gum disease called abfractions.
Okay.
You're seeing the root of the tooth, and the gum tissue is pulling away from the tooth. So these teeth eventually she'll lose them. And then they have to put in implants and crowns or bridge work. So it's nothing to fool around with, actually, because this all starts when you're a child. It can start at birth with nursing incorrectly because of a tight lingual frenum. So the frenum issues are real, and they can end up like this, where the person has tremendous amount of gum disease. They've had many fillings. They've tried to save their teeth. Here's a tooth that's been lost. And here's a person who's in serious condition. Literally, he's pushing his tongue so much against his teeth all day and all night that his teeth are pushing out of his mouth. Wow. And you can see here all the abfractions that this person has, and the gum loss around the teeth. So it's a really serious problem that we have to pay attention to. These people here are losing their teeth. I mean, literally, there's almost no bone left around these front teeth. And he's already lost some of the lower front teeth. The tooth over here. And here's another person that this is the resting tongue position. I didn't put the picture in of the swallow, which I should have. But he swallows, the whole tongue fills this front of his mouth. You can't hardly see the teeth. So this is a very serious thing. And notice all the plaque around the teeth. This is not good for his health. This affects his heart.
Okay.
Probably has a heart condition.
Wow. Yeah.
As well as these issues. Now, here's a person who has a partial, but the partial is not comfortable for her. And so she keeps taking out the partial. But look at her tongue thrust.
Oh.
So every time she swallows, her tongue is pushing against her partial. And that's why her partial is uncomfortable. So the partial can't stop the tongue. It can hold it inside the mouth, but eventually she'll wear out these teeth that the partial is attached to. So here's a person who's had dentures.
Okay.
And, she's having difficulty wearing the dentures and keeping them in her mouth just because of her tongue thrust. And so it's, some people think, well, I'll just have my teeth removed. And that's going to solve the problem. But it doesn't, unfortunately. And so she's constantly taking her teeth out, and look at how collapsed her face is with her teeth out of her mouth. And of course, it's hard for her to chew up food. And every time she swallows, it dislodges her dentures. So they're compromised all the time. And then we have speech issues because the tongue thrust just doesn't go away because they're becoming an adult or are an adult. So we have people when they're talking, like this person is thrusting the lower jaw forward as she's saying a sound. Here's someone with the tongue completely between her teeth when she's saying an S sound, or another sound that's like this a lot are the L sounds. And then we have speech issues of facial modifications that they make just to say the sound. And here you can see, again, the tongue creeping out between the teeth. And there is no sound except the TH sound. And the TH sound comes forward because it vibrates, the tip of the tongue vibrates on the edge of the upper front teeth when you say a TH sound. So it isn't the same, though, as because it's a light touch of the tongue on the teeth. So speech is a problem. And a lot of times you can't understand what they're saying. We call them mumbles.
No.
They mumble all the time. And so then we have people who have had braces, but the teeth have failed.
Yep.
Then they have braces again. Well, here's this person, nobody diagnosed his tongue tie. And so that's one of the reasons that he
Yeah.
has the forward tongue placement and has been pushing on his teeth all the time. So when I saw him, we had surgery on the tongue, and then he went back in for braces. And so hopefully this time the braces will actually work and
Yeah.
it will correct his teeth. The only problem is his mouth is too small. So he's probably going to have problems later on because, again, they took out 4 permanent teeth. And now it's routine for an orthodontist to say, well, let's take out the third molars too.
Oh, no, no.
Yeah. And we've talked about it before on some previous podcasts that when you take out the third molars, the only reason the third molars are there is for a concussion prevention. So a recent
Really?
project by a Midwest,
Didn't know that.
yes, they did a study. Why do we have third molars? Okay, they're not really the 6-year molars and the 12-year molars.
Yeah.
Your chewing molars, but the 6-year molars they found out are there to protect yourself from a concussion. So it's not necessary usually to pull out third molars. The dentists don't like to work on them because they're so far back if you get a cavity in them. But keep your teeth. That's the motto. Keep your teeth. Here's a patient who has had a surgical relapse.
Mm-hmm.
Look at her. I could diagnose her walking in the door. She's a mouth breather and she carries her tongue forward. Here, you can see her tongue, and here's her swallow. So guess what? She has a definite problem with opening up her bite. Even
Wow.
had surgery to close her bite. And here's another person where he's had surgery twice and he needs surgery again now. But nobody diagnosed the fact that this guy has a limited tongue movement because he has a very tight tongue attachment.
Yeah.
I felt so sorry for him because here he is, he was only in his late 20s when I saw him, and he's going to need a third orthodontic surgery, which would also fail. And he never came back because he found out he would have to have surgery on the tongue and then myofunctional therapy and then another surgery to correct the bite.
Aww.
So it's very expensive to have oral surgery to move your teeth. I know because I've had it done and it is very expensive.
Wow.
So
Wow.
airway concerns are also a big issue in this,
Mm-hmm.
more so than I've ever seen it be a problem. And people
Wow.
are diagnosed with sleep apnea. So I put
What is sleep apnea, by the way? I'm confused with what it is.
sleep apnea means that you're having problems when you're sleeping because the tongue falls back against the throat and the soft palate falls back against the throat.
Okay.
You literally stop breathing.
Wow.
So sleep apnea is the term that it's been given
Mm-hmm.
because a person can't breathe well at night. And that's one of the reasons I had to have surgery.
Got it.
As a child, I was born with an orthodontic restriction,
Oh.
my lower arch. So my lower arch was too far back, and my
Mm-hmm.
upper teeth were inside my lower teeth. So
Yeah.
I had a major orthodontic problem, but
Mm-hmm.
I had allergies.
Okay.
Um, I'm lucky actually I'm still alive because
Wow.
I couldn't afford to have a surgery done.
Oh.
And I finally ended up with a car accident, which I got a settlement years later. And then I was finally able to do my
Unfortunate but fortunate, right? Hey, we'll take what we could get. Glad you're okay though.
those mishaps that turn into a positive.
Yeah.
But airway issues are such a big deal these days, and always has been, of course, but it's even worse now. And so if you look at this x-ray of a skull, here's your spine, okay? Here's your teeth. This is your lower jaw, and here's your whole lower jaw. This is the tissue. Here's your chin. Here's your lips and your nose. And this right here is your airway.
Okay.
So here's your nose, and then you have an open airway. And whoops, excuse me,
Okay.
I went too fast here.
It happens.
But I have my finger on the mouse. And so this area here from the nose should be big and wide.
Mm-hmm.
It should go all the way down to your lungs. Well, when that airway, look at this, is very small. It's probably about 1.5 millimeters. This was my airway. I had 1.5 millimeters. So this airway on another person is a little better. It's bigger, but it's still not really the way it should be. This might be maybe 5 millimeters in width, but this is the way it should be. It's supposed to be 12 millimeters in width. And so the portion that comes down from your nose,
Okay.
that open all the time to get the proper air. Okay. So if we look at this picture, here's drawings of how your face should look. Nose, lips, and chin in alignment, nice form, and you're breathing through the nose. So now we have a person, a mouth breather, and so the lips are open. Now they've got a short upper lip and a full lower lip, and they probably are going to have tightness in their chin.
Okay.
And their face looks very flat.
Yeah.
Now, if we look at these same two people and we cut their head in half, here's their nose and their airway.
Okay.
So notice how wide that is. That's that 12 millimeters that we were looking at on the x-ray. Their lips are closed, so they're breathing through their nose. So they have a longer upper lip. And this is inside their mouth. Here's the palate, and here's the teeth. And now this is the tongue. Okay, so this right there, and everybody thinks that their tongue is right like this. That's their tongue, which is true, except that the tongue actually goes all the way down into their throat.
Okay.
So it's a very big muscle. And there's a trivia question, what's the strongest muscle in the body? And it's the tongue, which is amazing, right? So every time we swallow, we exert around 15 to 18 pounds of pressure against the top of the mouth. But here's a person that doesn't swallow correctly, and look at their tongue at rest. It's down, and now this person will probably end up with sleep apnea with the tongue falling back against their throat at nighttime. And their palate, which shows right here, is too high. So they've got a narrow arch instead of a wide arch. Okay. And their tip of their tongue is forward. So it might be against their teeth. It might be between their teeth, like the slide that I showed with the tongue forward. But it's incorrect. Now here in these people, we're looking at a swallow. And we swallow usually twice a minute during the day and once a minute at night. And so we swallow a lot every day. And we might swallow less than that, but we still swallow hundreds and hundreds of times. So here's a normal swallow. The lips are closed, the chin and lips are quiet, and the tongue is still across the top of the mouth, just like here.
Yeah.
But now the back of the tongue totally pulls back and touches the throat.
Okay.
So, and here's a blob of food that's being swallowed. Okay.
Wow.
But in this person, they are not swallowing correctly. Remember, the tongue is resting downward. And so when they swallow, even if the tongue comes up, it's not going back. So when they swallow, they're actually swallowing a lot of air. So a lot of my patients come in with stomach issues.
Oh, yeah, I'm
GERD,
sure.
gas, burping,
Mm-hmm.
stomach aches. And it's because they're swallowing all this air all the time. And they end up with gum disease and bite problems because that force of the tongue is forward instead of back. Okay. So they end up using their chin muscles, so their face ages faster. So there's so many things about being correct and incorrect. Now here's some anatomical photos. So if you took the skin off of your face, this is actually what you would look like underneath. We are a big giant muscle in our head. Of course, here's the lip muscles, here's the eye muscles, the nose has muscles, here's the temporalis muscle that's over your ear and over your jaw joint, and here's the masseter muscle that is here. And if you're a clencher or a bruxer, you overdevelop the masseter muscle and the temporalis muscle. So they can end up with a lot of pain in their jaw and jaw joints. Here's a picture of your skull. So here's the temporalis muscle, and here's the masseter muscle. Here's your teeth and your nose. Now look inside the mouth, and there's a whole series of muscles called the pterygoid muscles, and there's a whole bunch of other muscles in the mouth itself. And here's your teeth. So here's your jaw joint.
Mm-hmm.
And then this is a picture of your jaw joint. And here's a picture of your jaw joint.
Okay.
So a lot of the people that I see end up with jaw problems and jaw issues and orthodontic problems and surgical problems. So it's a very serious problem that we're talking about for adults.
Wow.
And most adults have no clue that they just see dentists, for the problems. But most dentists have no clue that myofunctional therapy exists. And it's just a series of exercises that we do twice a day. You see me once a week for about a period. It takes me about 4 months to train all of the stuff I just showed you.
Beautiful.
And usually they have a chance to save their teeth.
Yeah.
And their mouth is much cleaner. They're able to take care of it easier. They're no longer
beautiful.
So that's my story about adults.
We love speaking with you. Thank you so much for helping all of us, all different ages. And would you mind sharing how we can contact you? Thank you so much.
You're very welcome. So they can call me at 805-452-4302 or my website, www.tonguethrust.com.
Beautiful.
So thank you, Jill.
Thank you so much, Barbara Greene. Always a pleasure having your amazing spunky energy joining us. Thank you so much. Looking forward to next time. Okay. Have a great day.
All right.
Thank
Bye.
you. Bye.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.